Welcome, bienvenue, welcome, ladies and gentlemen, all of you. Welcome on board for our third trip together. Do you remember that on the 21st of September 2021, we traveled together during Virtual Voyage 1 and we discovered how much the 2Cs program benefited the territories. On the 29th of September 2022 in The Hague, we met in person to look at the concrete achievements of the 2Cs projects, to see what they have to offer, to build on what they have accomplished, and to think about how the 2Cs community can reach new heights. Today, I have the pleasure to take you on a new voyage focused on social innovation. The purpose of this voyage will be to showcase the social innovation project's key features and promote opportunities for future cooperation. This virtual Voyage 2 on social innovation will be organized into 3 journeys. The first journey is a quick reminder of what social innovation is and how the 2Cs program promotes this in the program area. The second journey is the main body of the voyage, interviews with representatives of 9 projects which will showcase good social innovation practices and achievements. And finally, in the third journey, we will see together what could be the opportunities for future cooperation in the European Social Fund Plus. But before we start our voyage, I would like to briefly explain a simple housekeeping rule for today's event. You may have noticed that your camera and microphone cannot be turned on during this event. This is not because we would not like to hear from you. On the contrary, we would be very much interested to find out what you think of today's voyage and whether you might have questions about the projects and their achievements. That's why we would like to invite you to feedback on today's event via the 2Cs Virtual Voyage 2 survey, which will be sent to you shortly after the event. We look really forward to receiving your reactions and we will make sure to provide you with answers to your questions in due time. So, we're almost ready to set sail for the first journey, but please, firstly allow me to express our sincere thanks to all who have contributed to the adventure, and particularly the representatives from 2Cs projects and ESF+. This voyage is a result of joint efforts and it demonstrates once again the cooperative spirit of the 2Cs community. Now's the time to start our first journey. Julie, you are the head of project unit of the 2Cs program. Could you please remind us what social innovation is exactly?
Thank you, Wim. If we refer to the definition of the European Commission, social innovation refers to the development and implementation of new ideas, such as products, services, and models to meet social needs and create new social relationships or collaborations. The aim is to make local services more efficient and effective, or to develop new services in niche areas which are not yet covered by public services.
Now, is there any particular approach adopted by the social innovation projects?
Absolutely. In terms of approach, involving directly the end users in the creation of the new solutions is an important aspect of social innovation, which is very much linked to the notion of empowerment. It also contributes to making these projects and their results durable.
Interesting. Now, can you tell us a little bit more maybe about social innovation projects then in the context of the 2Cs program?
Well, this topic has actually been the most popular of the 7 specific objectives of the program, in terms of number of projects approved and implemented, with a total of 20 projects, representing nearly 25% of all our projects. Now, in financial terms, the total ERDF budgets of these 20 projects represent the same proportion of the program total ERDF budget, that is to say 25%, with nearly 63 million euros committed.
And Julie, what do these projects actually look like? What themes do they focus on?
Actually, our projects really reveal the horizontal dimension of this topic, as they cover a wide variety of themes for the benefit of all the citizens, from young adults to the elderly in need of support at different stages of their lives, to face, among others, the challenges of unemployment, parenthood, integration, education, healthcare and well-being, or aging independently in both cities and rural areas.
Are there any other specificities among the social innovation projects, anything else that completes the ID card, let's say, of social innovation projects within the 2Cs program?
Yes, it is indeed worth mentioning that these projects are based on experimentations and evaluations, and they deliver primarily pilots and demonstration actions, as well as physical infrastructures or equipment and online tools to seize the opportunities of digitalization. Their ultimate goal is to scale up and roll out the demonstrated solutions in order to create a positive and meaningful impact on communities and society as a whole.
Thank you, Julie, for this warm-up. Now I will turn to Elodie, Senior Finance Officer in the 2Cs programs. Elodie, can you please explain to us what is a good social innovation project within the 2Cs program?
Thank you, Wim. Yes, I can. In Europe, social innovation is often confused with social enterprise or is limited to the work of non-profit organizations. Therefore, when the current programming period was launched, because people involved in the 2Cs area had different understandings about what a social innovation project should be, we wanted to be really clear on our definition. The different delegations decided to sit together and to agree on one single approach. From this discussion were identified 6 different criteria that projects had to meet in order to be considered as social innovation projects. These criteria are, firstly, the social need is the main driver of the project. There is a good understanding of the social need from previous experience, for instance, but also from focus groups or from an existing prototype. Secondly, the project is innovative. It addresses either unmet needs, process innovation, or new products, new services. It has a clear vision on what kind of society this innovation should lead to, also known as the theory of change. There is an approach on measuring the real impacts of this social innovation. This impact will be sustained well beyond Interreg support. The projects are led by different partnerships with relevant and complementary expertise. We usually talk about the quadruple helix in this context, which includes the academic sector, companies, non-profit, and the public sector. Lastly, projects are participative and empowering. The end user are involved in the project design and execution. Once these criteria were set up and agreed on, we saw a big difference. It was much easier for the project to understand what was expected from the program's point of view. It also helped the program to understand how we could more efficiently support the projects.
Now, I believe today 9 of the projects will be showcased. How have these been selected?
As mentioned by Julie before, there have been 20 social innovation projects approved within the 2Cs program. These projects have covered a tremendous diversity of different topics and have done some really fantastic work with great outputs. Due to the limited time of the virtual Voyage, we had to make a choice and have decided to select 9 of them, which are, we think, very inspiring by the work they are doing, and I'm sure you will agree with us. We will first meet one of the SARI partners to understand how the 6 social innovation criteria have been put in practice. Then we will meet a partner from Orpheus who will tell us what the cross-border cooperation has brought to the project. Path, Flavor, SpeedU Up and Hair will then demonstrate how they have delivered relevant outputs and tangible results. Later, Shift will explain to us how well they have been communicating about their project impact. Finally, BHE21 and I Know How will speak about durability, transferability, and the importance of scaling up.
Thank you very much, Elodie, for telling us a bit more why we will get to know these projects even better. And they look good. I must say, I'm very excited to see what they have achieved. Now it is time to see what these projects have put in practice, how they have created a more inclusive and sustainable world. A 2Cs Social Innovation Project is a project that meets the 6 criteria as agreed by the program and member state delegations. But what does it mean in practice? Let's have a look at what has been done with the successful SARI project.
SIRE stands for Social Integration of Refugees Through Education and Self-Employment. It aimed to improve the social and economic integration of refugees and migrants in the 2Cs region with a two-pronged approach that focused on education and entrepreneurship. The social need relies on tackling the key societal challenge of social exclusion of refugees and migrants into education and the labour market. The project provided the target group with the necessary resources and skills to empower them to increase their educational opportunities and pursue self-employment, thereby fostering their integration into society.
So in all the elements of this project we involved the target group, which were refugees and migrants. So the learning communities per se were the refugees and their parents of the refugee children were in the center of these learning communities. They were very often in the role of trainers as well. We had refugees working as moderators there, as well as even at UCR we had refugees working as interns, researchers in this project. So we really tried to involve the target group in the project, not just do it for them, but do it with them and by them.
Teachers and school teams feel better prepared to support and have better insights into the needs of parents and students with a migrant or refugee background. Schools can be more inclusive and meet the unique needs of these target groups, which helps promote equal access to education and create supportive and welcoming environments. In the long term, this may lead to improved academic success, social and emotional well-being, parent-school partnerships, and community integration of the target groups.
So we used the quantitative and qualitative measures. We measured quantitatively the improvements of the teachers' self-efficacy. We used surveys among the participants, among the teachers. We used in-depth interviews with the participants of those learning communities. We kept recording of all the learning communities. We also kept a record of hard data. Such success rate of those companies that were started by participants of the program. We had partners that had expertise in the co-creation. We had partners that were specifically experienced in stimulating entrepreneurialism. We had partners which had experience in teachers' education and education in general. We had partners such as municipalities that could provide us with the networks, existing networks in the area. We had community partners that already worked with refugees and migrants, so they had good network of contacts there. So it was very broad, and each partner complement other partners with their expertise of their particular strength that they brought to the project.
The involvement of the target group was an integral part of the project. The co-creative methodology that was applied throughout the project was chosen because of its participatory elements that allowed the target groups to be involved in the different stages of school making. Also, when the entrepreneurial part was setting up the refugee online networks on LinkedIn and Facebook, the online events to help build a community were facilitated by a refugee. Finally, refugee interns participated in the data analysis at the UCR. As for empowerment, we can conclude that the self-efficacy of participating teachers in the context of supporting refugees and migrants significantly improved. Also, participating refugee and migrant parents pointed to several positive impacts, such as improved sense of belonging, ownership, support networks, relationships with the teachers, and information about the school system.
Thank you very much. It's now much more clear to us all, I think, what the 6 social innovation criteria are and how a 2Cs project can work with them. A key aspect of the 2Cs program is cross-border cooperation. And this brings us to our second stop in Belgium, where we will meet Werner van Herle from the Department of Prevention and Safety in the city of Mechelen. He is the lead partner of the Orpheus project, and Werner will explain what cross-border cooperation has brought to the project.
Orpheus staat voor Offline and Online Radicalization Prevention, Holding Back Extremism and Upholding Security. Een hele mond vol dus, maar het vat wel samen waar het project over gaat. Het project wil jongeren weerbaar maken tegen alle soorten van gewelddadig extremisme en professionals ondersteunen in het weerbaar maken van jongeren. Orpheus ontwikkelt hiervoor nieuwe instrumenten en test ze uit. Het Orpheus Consortium bestond uit 3 Belgische, 2 Nederlandse, 2 Britse en 1 Franse partner. Orpheus geeft jeugd- en preventiewerkers een methode om samen met hun jongeren een veilige ruimte, safe space, te creëren. De bedoeling is frustraties, boosheid, wrok enzovoort, die ze koesteren tegen vertegenwoordigers van de samenleving, hetgeen een voedingsbodem kan zijn voor gewelddadig extremisme, vooral goed te begrijpen. Om hen vervolgens in staat te stellen er binnen een democratisch handelingskader uiting aan te geven. De experimenten met dergelijke safe spaces, zowel fysiek als online, hebben ons veel geleerd en stelden ons in staat handleidingen en trainingen op maat te ontwikkelen. Alle resultaten zijn in 3 talen terug te vinden op www.orpheusproject.eu. Het interessante is dat eerstelijnsprofessionals, onderzoekers en beleidsmakers uit verschillende landen hun inzichten en goede praktijken met elkaar konden delen en ze konden opschalen naar nieuwe instrumenten. Dit zorgt ervoor dat onze producten zowel een academische onderbouwing hebben, maar ook de praktijktoets doorstonden in België, Nederland, Frankrijk en het Verenigd Koninkrijk. The proof of the pudding is in the eating. Orpheus is meer dan een samenwerking over landsgrenzen heen. Het cross-border aspect heeft ook betrekking op de intersectorale samenwerking. Dus niet alleen België, Nederland, Frankrijk en het Verenigd Koninkrijk brachten experts in zaken radicalisering rond tafel. Het consortium zorgde voor een diversiteit van perspectieven door de academische wereld, lokale besturen en scholen of jongerenorganisaties samen te brengen. In ieder geval heeft Orpheus de interne werking geïnspireerd. In onze aanpak rond discriminatoire geweld bijvoorbeeld komen een aantal kenmerken van de Orpheus-methodiek sterk terug. Zelfs de Vlaamse overheid heeft inspiratie gevonden in deze methodiek. Zo is er recentelijk een oproep geweest naar experts die ervaring hebben met het oprichten van veilige ruimte.
Thank you very much, Werner. It is great to hear that cross-border cooperation can bring inspiration for new methods. Social innovation is defined by the creation of new products, services and models leading to sustainable changes. Let's have a look now at 4 fascinating projects: Path, Speed You Up, Flavor and Air, and their committed representatives who will tell us how they have achieved relevant outputs and measurable results. First, we welcome Inge Tansy, midwife, lecturer and researcher at the Odyssee Hogeschool in Sint-Niklaas in Belgium, which is a partner of the Path project.
PATH stands for Perinatal Mental Health, referring to mental health during pregnancy and parenthood. We want to enable women, families and healthcare professionals to prevent, diagnose and successfully manage mild to moderate perinatal mental illness. We did this by developing online and face-to-face services and tools. We worked with different kinds of organizations in 4 countries, such as organizations providing mental health support, city councils, universities, universities of applied sciences, public health departments and services, hospitals, governments and other different associations and federations. I believe this was one of the strengths of our project. Although we went through the COVID period, which was a challenge for the project and certainly for the face-to-face part, we were quite successful. We reached more than 50 million people with our multimedia campaign to increase awareness of perinatal mental health. Our online hub was accessed by more than 150,000 visitors. All our activities were summarized in the magazine Vroeg, reaching more than 30,000 people. Also, over 7,000 healthcare providers and employers were reached with information and training sessions. We also tried some new approaches and technologies such as a comic strip tool. This tool was created by Bournemouth University and can be used to tell stories and share experience of clients about mental health. For example, Odyssey University of Applied Sciences developed a tool for midwives and other healthcare providers to talk with the women about a traumatic birth experience. We used the comic strip tool to share stories of women who experience a traumatic birth, functioning as a kind of peer support. Also, a dialogue tool using comic strips was developed to support healthcare providers and women to talk about this topic. Although the COVID pandemic, we achieved almost all general objectives of the PATH project. We want to improve the skills and knowledge of healthcare providers so that they effectively can recognize and treat perinatal mental illness. We focused on both face-to-face training, e-learning, and information and tools on the hub. The same approach was used for employers, where we want to increase awareness and breaking the taboo on perinatal mental health. The feedback of healthcare providers and employers was positive. They found the trainings and the tools informative, interesting and useful in daily practice. We try to disseminate further our results in conferences and other events. The hub will be online and accessible another 5 years.
Thank you, Inge. These training courses for healthcare professionals bringing positive changes in the healthcare sector are a great example, I think, of a highly relevant output in the 2Cs program. Let's jump on board and continue with Theo Grefkens, Tessa de Bakker, Dylan Adelaar and Amber Bontekoe from the Knowledge Center Stichting Kenniscentrum Pro Work at Burghamstede in the Netherlands. They were a partner of the Speed You Up project.
We zijn als organisatie betrokken in een project samen met 13 andere partners uit 4 landen in het 2Cs project Speed You Up. En de bedoeling van het project is om jongeren te begeleiden naar hun eigen zelfstandig ondernemerschap. Het staat voor Need, Not in Education, Employability and Training. En als organisatie waarbij wij als ProWork de moeite doen om kinderen of jongeren te begeleiden naar banen voor jongeren met een afstand tot de arbeidsmarkt. We hebben in het project samen met andere partners hubs ontwikkeld, ook hier in Nederland. En uiteindelijk zijn daar pop-ups uitgekomen waarbij we at risk, zoals wij dat noemen, jongeren met een bepaald risico, niet als drop-out door te laten gaan, maar ze op te vangen en te proberen zelfstandig ondernemerschap te creëren.
In het Speed You Up project hebben wij gekozen voor een individuele benadering ten opzichte van een groepsbenadering. Dit kwam deels door corona, waardoor we niet in groepen samen konden zitten. En we hebben ervoor gekozen om de hub zodoende op ons kantoor te starten, waarbij de jongeren bij ons echt binnenkwamen en hier met ons samenwerkten aan hun eigen bedrijf. Het verschil met Speed You Up en andere projecten is dat we in Speed You Up echt eigen bedrijven zijn gestart met jongeren. We hebben 2 voorbeelden uit Nederland. Eén daarvan is een schoonmaakbedrijf, waarbij een jongere een schoonmaakbedrijf is begonnen, heel lokaal, en daar was ook echt behoefte aan, wat erg leuk was. Het tweede voorbeeld is een jongere die een stichting is begonnen voor kinderen die te vroeg geboren zijn, om daar meer wereldkundigheid aan te geven. En ook daar hebben wij geholpen om dat op te zetten, hebben we een website gemaakt en hebben we geprobeerd om deze jongeren op een goede manier te begeleiden.
Ik ben bij ProWork terechtgekomen doordat ik hun heb geïnterviewd bij de radio waar ik vrijwilligerswerk doe. En ik merkte tijdens het interview al dat ik super geïnteresseerd was in wat zij allemaal doen. En toen heb ik ze daarna een mail gestuurd en gezegd wie ik ben, dat ik bezig was op dat moment met het oprichten van een platform voor te vroeggeborenen om meer bekendheid te geven aan gevolgen van vroeggeboorte. En ik vroeg me af of zij mij konden helpen met het opzetten daarvan en met het vormgeven daarvan. En hoe je meer mensen kunt bereiken en het maken van een website. En dat zijn allemaal dingen waarmee zij mij geholpen hebben. En daarnaast ben ik nu bezig met het maken van een stichting. Dus mijn platform wordt een stichting. En daar heeft Theo me heel erg bij geholpen met wat komt er nou allemaal bij kijken. Het regelen van een bank, het regelen van statuten, hoe dat allemaal in zijn werk gaat. Daar zijn we nu mee bezig. Ondanks dat het project al is afgerond, zijn we nog steeds stappen aan het maken en word ik nog steeds geholpen door ProWork, waar ik heel blij mee ben.
Thank you, Theo, Tessa, Dylan and Amber. What a fantastic and dynamic hub you have there. Ready for the third example of relevant outputs and measurable results? So let's go to Boulogne-sur-Mer on the French coastal area, where I have the pleasure to welcome Sophie Cazenave, Director of Panier de la Mer and partner of the Flavor Project.
Le projet Flavor, qui veut dire saveur en anglais, est basé en fait sur la valorisation des invendus dans les entreprises ou dans le port au profit de l'aide alimentaire, tout en créant de l'emploi pour des personnes en précarité. Donc ce projet-là correspondait complètement à l'objet social de notre association, les Paniers de la Mer. Nous sommes spécialisés, notre association, sur l'accompagnement professionnel de personnes en précarité, sur la valorisation d'invendus dans les ports de pêche et les entreprises. Donc quand les partenaires belges sont venus nous chercher pour participer à ce projet-là au niveau européen, on a été d'autant plus engagés puisque ça nous a permis à nous de développer de nouvelles activités et de monter en puissance sur cet axe de valorisation et d'aide alimentaire. Concrètement, ça s'est développé sur deux axes. On a pu optimiser et améliorer notre collecte et notre redistribution au niveau d'aide alimentaire en sollicitant de nouveaux partenaires, des nouvelles entreprises qui nous ont permis d'augmenter ce volume-là. Puis un deuxième axe qui a été également le développement de nouveaux produits. On se trouvait face à des dons qu'on ne pouvait pas valoriser en interne. Et du coup, on s'est associé avec des partenaires industriels pour pouvoir à la fois faire une soupe de poisson, mais également des plats préparés pour redistribuer également à l'aide alimentaire. Soit près de 80 000 plats ont pu être distribués grâce à Flavor. Et pour finir, au bout de ces 4 ans, toute cette expérimentation nous a permis de consolider en interne un fonctionnement et de partenariats qui nous ont permis maintenant, encore à l'heure actuelle en 2023 et sur les prochaines années, à développer de nouvelles gammes de produits et performer sur de nouveaux partenariats et de nouveaux volumes à redistribuer.
Thank you, Sophie. The reduction of food loss and waste combined with the inclusion of the needs is an excellent example of valuable outputs. Our last example of good achievements brings us to Cornwall in the UK, and we are happy to meet Keith Hambley-State and Kathy Withmore from the Fioc Parish Council and Catherine Leishon from the University of Exeter, partner and lead partner respectively of the AIR project.
HAIR stands for Healthy Ageing Through Innovation in Rural Europe. In HAIR, we tried to grow social innovation from the ground up. We wanted to tackle loneliness and isolation amongst older people living in rural communities. We worked with partners in Belgium, France, the Netherlands and the UK. And amongst those partners, we included small municipalities, social work organisations, parish councils, and other organisations that were trying to work in their communities. We sought to empower older people to have a say in service design and delivery. And through our HAIR toolkit, we developed a way to tackle loneliness and isolation for them, as well as developing all kinds of community activities that helped older people to get out and about. Parish councils are the third tier of local government in England. They're run by volunteers and they're a very important part of service design and delivery in rural areas. Parish councillors and the staff who work for them are very close to their communities and have a really good understanding of what those communities need to thrive. Working with a parish council like FEOC added enormous value to Hare because they were able to develop community capacity and really build vitality in this community through the work they did.
One of the values of the project was the way we gained trust and confidence of local people. A lot of projects have started and ended as funding has come and gone, and people questioned initially whether this was another example. But Hare has enabled us, it's given us the time to think about the issues, and my council has had a good opportunity to develop various schemes which they sought through Hare to implement to help the well-being, support the well-being of local people. We interviewed some 200 people to find out what they needed, and one of the outcomes of this was the need for continuity. And as a result of this 3 year project, we've been able to appoint a member of staff who will provide that continuity. And how do we provide the continuity? We're able to do it because we're a tax-raising body as a local council. And if there's a business case, and we believe there is a business case in supporting the well-being of our people, we are able to raise a tax, and in this case, to appoint somebody to provide the continuity, the sustainability, if you like, of Hare post-project. So we have a Hare legacy.
My role with FEOC Parish Council is information and wellbeing advisor. It's to make people feel well, able to get out and about, have somebody to talk to, and speak to me because I'm really friendly, and that enables me to work with the council to provide societies and clubs that people want to go to support them and to help them with their administration and their marketing, providing it a free service and buying in their trust that we can provide something worthwhile for their club, their society, and create this feeling that we can share it with other communities. We can help them build their ideas up.
Thank you very much, Keith, Kathy and Catherine. What an ambitious project with some very sustainable results. Thanks to great interventions by the representatives of PATH, Speed You Up, Flavor and Air, it is definitely more clear what social innovation is in practice. And it also shows the wide diversity of topics that can be covered under social innovation. Let's move to our fourth stop, which will highlight another characteristic of good social innovation projects, which is a project that communicates its impact well. We stay in the UK and we will have the chance to meet Emma Jones, Head of Insight, and Vicky Faminu, Head of Sexual and Reproductive Health at Metro Charity in London, a partner of the Shift project.
SHIFT stands for Sexual Health in the Over 45s. The SHIFT partnership wanted to improve sexual health and well-being of people aged over 45 specifically, and particularly those who are vulnerable to poor sexual health outcomes. 129 people aged over 45 participated in the initial qualitative research on sexual health lived experience and needs from both the general population and target marginalised groups, including migrants and refugees, people experiencing homelessness, drug or alcohol misuse, and also LGBTQ+ people. A pioneering new model of sexual health practice for engaging people aged over 45 was created to improve equality of health outcomes. A comprehensive virtual training package for healthcare professionals was produced and delivered across the partnership's regions. This was undertaken by 778 healthcare and wider workforce professionals. A key communication tool we used in this project was filmmaking. Translating the content of research focus groups and interviews with over 45s into dramatised scenarios and we produced 6 short films. Each drama tackles a key topic which emerged from the research: intimacy, menopause, new relationships and HIV-positive status. We also made a film on migrants' inequalities in accessing information about STIs and testing services, and also the stigma around older people testing for STIs and ageism. The films alone have had almost 3,000 views over the course of the SHIFT project, and that engagement and dissemination is ongoing.
The sexual health model developed by the SHIFT partnership was piloted in a variety of public locations in the UK during summer 2022. This included high streets and other locations specifically targeting marginalised communities such as the LGBTQ+ Pride. A key outcome from this was engaging and referring isolated groups. So we were able to meet with many isolated over 45s who didn't naturally have supportive social groups and actually needed the engagement. We were able to identify referral pathways such as local sexual health clinics and services and broader health services such as menopause, and a key topic was pelvic floor issues. Another key outcome was overcoming barriers and stigma. We found that a number of people that were sharing their experiences were quite grateful to have the opportunity to talk about it with other people they met on our outreach store. Another key learning point was our own unconscious biases and how we needed to tailor our approach to different communities, considering issues such as culture, religion and other identities. Another key finding from the project was how conservative members of society were talking about the topic of sex for an otherwise quite progressive community. So we had to make ourselves especially relatable and approachable. So the use of humour was a really good tool for this, as we used playful tools such as eggs for pelvic floor exercises, sex toys, lube, sweets, and condoms, and anything else that helps stimulate conversation. These conversations were really engaging and allowed members of the community to actually talk about topics such as prioritising women's pleasure, which they otherwise wouldn't. So another key outcome was destigmatising age and actually addressing the topic of age in a humorous way. Unlike many of the generations that came after them, they weren't provided the opportunity of sexual reproductive health education, and so are currently benefiting from new age of sexual health renaissance. We were also able to have some really fun conversations with mums seeking condoms for specifically their sons, but also using that as a tool to engage them on their own sexual health needs, such as their pelvic floor and the impact of menopause.
Thank you very much, Emma and Vicky, for your very complete and detailed intervention. Having to deal with different target groups requires a strong focus on communications indeed. And finally, a social innovation project is a project that is durable, transferable, and has the capacity to scale up. And that brings us to our last stops with BHC21 and I Know How. And our first stop here is Senlis in France, where we are happy to welcome Philippe Sellier, Industrial Development Advisor of the BHC21 project.
Le projet BHC21, Boosting Human Capital in 21st Century, pose une question d'apparence simple. Comment rendre des jeunes, exclus du marché du travail, employables par des entreprises en recherche permanente de main-d'œuvre? Cette question en appelle d'autres. Les nouvelles technologies d'apprentissage peuvent-elles suppléer les formations traditionnelles que ces jeunes ont majoritairement rejetées pendant leur cursus scolaire? Peut-on utiliser ces nouvelles technologies sur des métiers extrêmement techniques? Comment s'assurer que ces jeunes auront envie d'apprendre et de s'intégrer en toute sécurité dans un milieu industriel? Pour répondre à ces questions, nous avons travaillé avec des partenaires belges de la Wallonie et de la Flandre, des partenaires anglais du Kent et des partenaires français. Ce projet complexe et innovant a nécessité plusieurs étapes. D'abord le recrutement et l'évaluation du public, la création du parcours de formation, aussi bien sur les soft skills que les formations techniques, la création d'un outil de formation innovant basé sur la conversation orale, la création des scénarios pour piloter la mise en œuvre de l'usinage d'une pièce mécanique sur une machine d'usinage, un arbre de décision, la formation des formateurs et enfin une évaluation finale du public. L'ensemble de ces étapes a été réalisé. Nous avons rendu employables 6 jeunes, exclus du marché de l'emploi grâce à des méthodes pédagogiques innovantes basées sur les nouvelles technologies. Nous avons choisi de les former sur des machines d'usinage à commande numérique, car ce métier est en tension dans les entreprises mécaniciennes. L'outil d'apprentissage utilisé est une tablette vocale qui interagit en langage naturel avec l'apprenant. Nous avons dû adapter les mots-clés utilisés par la tablette dans le cadre de ce projet. À tout moment et en complète autonomie, il est possible de déclencher une vidéo, afficher une photo en prononçant des termes clés comme « montre-moi »,« pourquoi »,« comment faire ». La démarche d'apprendre en faisant a eu un impact très fort sur ce public. Et surtout le fait de distiller la connaissance au fur et à mesure du besoin. Au fil des heures, les gestes étaient acquis et les apprenants se sont montrés capables d'usiner des pièces mécaniques. Nous avons dépassé nos objectifs car certains des jeunes ont été embauchés par les industriels à la fin du projet. Nous avons utilisé cette expérience acquise pendant BHC 21 pour un projet pilote dans la vallée de l'Arve à la demande de Pôle emploi. Pour cette opération pilote, nous avons pu capitaliser de BHC 21 les différents questionnaires d'évaluation, le scénario pédagogique global, les tablettes et les logiciels associés, les compétences acquises pour l'écriture des scénarios. Nous avons formé 3 candidats en étendant la formation au domaine de la robotique. Nous avons obtenu les mêmes résultats que pour BHC 21, c'est-à-dire une progression très rapide des candidats dans leur apprentissage grâce aux outils digitaux. Grâce au projet BHC 21, nous avons démontré que ces jeunes, exclus du marché du travail, avaient le potentiel pour retrouver le chemin de l'emploi, à la condition d'adapter la pédagogie avec des outils innovants.
Thank you, Philippe. This is a very good illustration indeed of how a project can scale up its output. And for the second and last stop here, we stay in France, this time in Lille. We welcome Laurence Van Lemmes, oncologist at the Centre Oscar Lampré, and Sandrine Morizet, associated patient, partner of the I Know How project.
I Know How, je sais comment, est un projet concernant le maintien ou le retour à l'emploi des personnes touchées par un cancer. L'objectif de ce projet est d'accompagner, d'améliorer l'accompagnement de ces personnes, mais également des professionnels de santé et du travail et des employeurs. Comment a-t-on fait? Nous avons créé 3 outils. Un à destination des patients employés, sous forme d'un travail sur un livret patient. Un autre pour les professionnels de santé, avec une journée de formation, et un autre à destination des RH d'entreprise sous forme d'une boîte à outils. Ces 3 documents et formations ont été co-construits avec l'aide des patients, avec des interviews, des coworking, et également des partenaires avec la MEL, mais également les partenaires travaillant sur la santé et sur le travail, comme la CARSAT, l'Agence régionale de santé, l'assurance maladie, le pôle santé-travail, etc.
Alors le projet m'a apporté beaucoup en tant que patiente, puisque ça permet d'avoir des réponses tout au long du parcours de l'après-cancer. Quand on est atteint de cette maladie, effectivement, on est beaucoup déstabilisé. Et ce livret permet d'avoir toutes les réponses, savoir comment l'annoncer à son employeur, comment l'annoncer à ses collègues, et aussi trouver les bons interlocuteurs au niveau médical, les bons médecins qui peuvent nous accompagner effectivement dans ce retour à l'emploi. Beaucoup de services sont mis en place grâce à Interreg. Et du coup, ça va permettre de faciliter le retour et certainement le maintien à l'emploi pour les patients.
Comme l'a dit Sandrine, les bénéfices attendus de ce programme sont la meilleure prise en compte de la problématique de l'emploi pour les personnes touchées par un cancer, donc les employés, mais également pour les professionnels de santé et du travail et pour les RH d'entreprise. Et d'autant que ça correspond à la stratégie décennale 2021-2030 de lutte contre le cancer qui demande que le maintien à l'emploi soit intégré dans le parcours du patient. Donc pour ces 2 raisons, nous avons souhaité continuer l'aventure avec une 2e étape qui aura pour objet de non seulement diffuser, pérenniser le projet, mais également mettre en des actions pour un accompagnement individualisé, prenant en compte les besoins aussi des patients, pouvant varier entre accompagnement individualisé, en collectif, des coachings, etc. On va faire ça avec les partenaires, notamment la CARSAT, mais aussi tous les partenaires de santé et du travail.
Thank you, Sandrine and Laurence. This is also an excellent example, of course, of how actions can be durable and transferable. We wish you the best of luck with the next step. So we have just seen 9 very nice examples of good practices in social innovation. And the question now is, how would they be able to continue their activities beyond the 2Cs program? Do they already have plans in mind for future opportunities? Let's listen to Inge, who will tell us what happens after PATH.
We brought the partners of 2 Interreg 2Cs projects together. PATH on one hand, and PACE about access to childcare and employment on the other hand. We are writing a new proposal for Interreg Northwest Europe, thereby focusing on perinatal mental health and resilient environments.
Thanks, Inge, and what a great idea indeed to capitalize on the results of the 2Cs project to develop a new innovative project. We wish you all the best with the Interreg Northwest Europe program. And maybe, like Inge, you already have some concrete ideas or means to continue your work, or maybe you don't know yet where to find new opportunities. And in that case, please stay with us, because the third and last journey of our voyage is dedicated to this aspect. You remember that during the 2022 2Cs annual event, Reaching New Heights, 7 matchmaking workshops moderated by guest programs allowed concrete exchanges with 2Cs community to see what opportunities could be open to them in the 2021-2027 programming period. We had representatives of all the other Interreg programs operating in the 2Cs area, including representatives from Horizon Europe and LIFE. And there we learned that social innovation was an important theme for them as well. So today we wanted to open a new door and see what could be the funding opportunities in another structural fund everyone knows by name, which is the European Social Fund, ESF, renamed ESF Plus for the 2021-2027 programming period. Knowing that ESF Plus is a fund with a very wide spectrum, impossible to grasp in just a few minutes, we have chosen to put the focus on the ESF Social Innovation Plus initiative, which is new. And I would like to welcome 2 new speakers who will help you to understand the essentials of the Social Innovation Plus initiative, which could be of great interest to you. First, Michael Groos from DG Employment with the European Commission will give us the essentials to know regarding ESF Plus, helping us to understand where the ESF Social Innovations Plus initiative comes from and what the expectations are at EU level and how it will be managed to reach the beneficiaries on the ground. Michael, thank you in advance for speaking with us, as ESF Plus is a fund with multiple areas of activity and many different ways of managing this. Giving us an understandable global picture of this in just a nutshell is a heroic task indeed. Secondly, we welcome Migle Alexonite from the European Social Fund Agency, which is the Lithuanian ESF agency in charge of the implementation of the ESF Social Innovative Plus initiative. Next to launching EU-level calls for proposals supporting the transfer and upscaling of social innovation across the EU, ESFA also organizes transnational exchange and cooperation through knowledge sharing, mutual learning and capacity building for social innovation stakeholders. We believe that this will be very interesting for you because they are creating a knowledge hub of social innovation, creating and enabling the conditions to transfer and scale up good practices of tested social innovations. Please, Michael, the floor is yours.
Thank you for inviting me to this virtual event today, all about social innovation. This is a great opportunity to share with you what the European Commission is doing to promote and support social innovation within the European Social Fund. My name is Michael Grosse, and this is precisely the topic that I'm responsible for. On my first slide, you can see how we define social innovation within the ESF Plus regulation. Let me highlight the second element marked green. This is about the active participation and ownership of citizens, businesses, academia, and the public sector. We need all of these actors and a strong collaboration to make social innovation work. So why is social innovation so important for the European Commission? Well, for us, it is crucial in dealing with the major societal challenges that we are currently facing. Most recently, this is about the war in the Ukraine, about inflation and the rising cost of living, but it is also about the COVID-19 crisis and the impact it had on our health systems. Looking at the bigger picture, social innovation is about dealing with migration and demographic changes too. And finally, we see a strong link between social innovation and the green and digital transition, two main priorities of the European Commission. But let's have a look at the different ways the ESF Plus supports social innovation now. So on my second slide, you can see on the top left side the EASY program, which is the Employment and Social Innovation program. And this is implemented directly by us, by DG Employment. This is about creating new ideas and pilot projects. The same initial phase may also be supported by national and regional ESF Plus programs. After this phase, we have the transnational cooperation in the center of this graph. That is facilitated by our partners from Lithuania, ESFA, and you will have Migle go into more detail after me. Finally, social innovation is about mainstreaming and replicating. So what works within one area or one region to transfer this to another area or another region. And this is again supported also by the ESF Plus. Migle will talk about the other tools that we have that are mentioned on the bottom of this slide, the Social Innovation Match database and the National Competence Centers for Social Innovation. I'm very happy to share this with you today, and I'm looking forward to hearing from you. Thank you very much.
Thank you, Michael, for helping us find our way in ESF Plus and understand more the link between the fund and the Social Innovation Plus initiative. Now I give the floor to Migle Alexonite from the European Social Fund Agency, who will explain concretely what are the key activities which could be of interest for the 2Cs community, including what assistance can be offered via the European Competence Center. Please, Migle, floor is yours.
Thank you for the invitation to participate in this event and to present European Competence Center for Social Innovation, which was established thanks to the European Social Fund Plus Social Innovation Plus initiative funded by the European Commission. We're based in Lithuania, in European Social Fund Agency, which for 20 plus years has been administering and implementing ESF projects. And 2 years ago, we were lucky to be selected by the European Commission as an interested entity to set up the European Competence Center for Social Innovation. I am Migle Alexonite. I was involved in the development process of the initiative, and now I'm in charge of transnational calls in the European Competence Center. Today, I will have only 10 minutes, so I will have to be brief, but the information and the slides will be available to you just right after the event. So let me begin to present the European Competence Center for Social Innovation. Here you may see our main missions. The Center offers mutual learning, capacity building and networking activities for European Social Fund Plus bodies, social innovation support structures and relevant stakeholders. We have communities of practice and networks to implement this mission, which I will discuss later. The Center also announces European-level calls and supports beneficiaries by organizing mutual learning activities, seminars, and other events. Also, the Center has the ambition to develop a knowledge-sharing platform to map the social innovation ecosystem in Europe. The Center will also validate and disseminate social innovation projects and will raise visibility and increase awareness of the value of social innovation. So today, I will emphasize the information which could be the most useful to you. I will talk about the current calls for proposals, which are already announced or in a pipeline. I will present communities of practice and transnational networks where you could take part in. I will very briefly talk about Social Innovation Match database for social innovations to be visible across the European Union and present the expert database that you might want to be engaged to. So the calls. They are usually open for different kind of entities across EU and member states. In December 2022, the very first call was published to help member states integrate ALMA, Aim, Learn, Master, Achieve initiative into their national programs by piloting or scaling up ALMA-type operations targeting vulnerable youth. In March, we received 34 applications and now grant agreements are being drafted. Although the call seems to be over, the following slides will show you why this information may still be relevant to you. Our currently open call is dedicated for national competence centers for social innovation, for building up and consolidating their capacity. And our two upcoming calls till the end of this year are foreseen for scaling up of social innovations, which have proved successful for the upskilling of vulnerable youth and for mitigation of societal consequences in the war in Ukraine in the EU member states. I will now briefly provide information about each call. Our call promotes the societal empowerment of disadvantaged young people. The aim is to help them integrate into society and to find their way into the job market by combining support for education, vocational training, or employment in their home country with a work-related learning experience in another EU country. Project implementation begins with a startup phase, during which partnerships are built, both national and transnational. And this is the part you might find interesting. This phase has just started in October and will last for 4 months. If you are interested to become a partner in these projects, you can familiarize yourselves with the terms of the call and apply as the context provided, or express your wish to be included into the ALMA Partner Search database. Just for your interest, this slide shows which countries ALMA projects applicants are from. Here, on the right, you may see the link if you wanted to be included into the ALMA Partner Search database. On the left, you can see the support our center provides to those who are planning to implement projects under our calls. This includes info sessions, trainings, mutual learning, and capacity building events, followed by published answers to frequently asked questions, prepared video material, how to fill in the application's budget, how to register to our IT tool for applications. We also try to reduce the administrative burden on applicants and prepare various supporting documents and templates for the calls, provide calculators for budget, help to find transnational partners, etc. This slide presents our current call for national competence centers for social innovation, which aims at building up and consolidating their capacity. The call itself builds on the lessons learned from the previous call by European Commission, published in 2020. Thus, the endorsement is required to participate in this call from ESF plus managing authorities. So it is a little bit restricted call, but for those interested, you can check out the other conditions at the link below, and have in mind that the deadline is till the end of November. Our upcoming call to be announced this October or November is for support of development and or transfer of social innovations that have proven to be successful in other contexts, countries or regions for the upskilling of vulnerable youth, especially young people not in employment, education or training. As the call is not announced yet, I cannot give you many details about it, but it's likely that there will be not many restrictions on applying entities, except for those for experience in a certain field. Almost the same applies to our fourth call to be announced till the end of the year, for promotion of socio-economic integration of the displaced people from Ukraine and to mitigate the societal consequences of the war in the EU member states. Please follow the news on our website to be well informed when those calls are announced. Now I will move to the second biggest part of our activities, knowledge sharing and capacity building, which is mainly done through coordination of 5 communities of practices and 2 transnational networks, the names of which you can see on the slide. Different experts and organizations may participate in those communities and networks according to the subject. Key policy stakeholders, line ministries, national agencies, networks, international organizations, social partners, experts with relevant knowledge, EU representatives, etc. The goal of this kind of knowledge sharing and capacity building is to set up professional infrastructure and transnational exchanges and cooperation to bring together relevant social innovation stakeholders, summarize knowledge, practices, tools, and methods of social innovation, develop methodological materials, studies, guidelines, trainings, and other useful tools for wider dissemination and application of social innovation in various contexts. In the following slides, you may find the thematic areas of communities of practice and networks, and you may kindly decide whether any of them might be useful to you. If you would like to join, gain, or share your experience, on the last slide you will find all the contexts where you can turn for information. Here I would like to briefly introduce you to the Social Innovation Match database. It is the database that aims to promote the transfer and/or scaling up of social innovations across Europe. Social Innovation Match provides an opportunity to showcase successful and inspiring social innovation examples and can be used as a search engine for social innovation stakeholders. If you want to know more about it or register your good example, please follow the link below. And the last piece of my information to you is about the call for expressions of interest for experts possessing different kinds of competences that might be necessary for our center to grow and develop. We are looking for experts with a high level of expertise and professional experience, in particular in the fields or the policy areas set out in the ESF Plus regulation, for example, employment, education, skills, social inclusion, and smart and green transitions across Europe. This call aims to select experts from all over Europe to support the implementation of centers' missions, to assist with the assessment of applications, capacity building, mutual learning, networking, and the provision of support to our networks and communities of practice. This is the last slide for your convenience, with all the contacts and links you may need in order to engage in the activities of European Competence Center for Social Innovation. Thank you for the opportunity to showcase the center's activities in your community. I hope you will find the information useful and that we will meet some of you in the near future. Have a good rest of the event.
Thank you very much, Miglia. Many thanks to all of our speakers today. We hope that you have discovered through the examples given some of the key achievements of the 2C's social innovation projects, and that we have opened the door for future opportunities in the ESF Social Innovation Plus. Now it's almost time to end our voyage, but before we finish, I would like to ask some of our speakers if they have some tips and lessons to share before we close the event.
Het grootste probleem binnen ons project was dat het eigenlijk tijdens de COVID-19-pandemie plaatsvond. Hierdoor hadden wij problemen met het uitvoeren van het project. Maar aan de andere kant gaf dit ook weer nieuwe opties. De eerste doel was dat we eigenlijk in groepsverband gingen doen. Dat ging hierdoor niet meer. Daardoor zijn we een individueel pad opgegaan. En zodoende is daar eigenlijk een heel mooi project uitgerold. Een andere tip is sociale organisaties van tevoren samenbrengen in plaats van tijdens. We kwamen eigenlijk tijdens het project erachter dat dit een lastig ding was, omdat dit gewoon niet zo lekker liep. En omdat dit van tevoren meer vast te zetten, kan je eigenlijk het project beter en sneller uitvoeren. Het andere advies wat we kunnen geven is het samenwerken met andere internationale organisaties. Je kan van elkaar andere bedrijven en organisaties leren en zodoende eigenlijk tot een goed eindproduct komen van een project.
Sans doute, nous aurions dû passer plus de temps en amont avec les industriels et les offreurs de solutions pour effectuer un meilleur benchmark des technologies disponibles sur le marché. Le premier point est de communiquer avec ces jeunes sur l'ensemble du dispositif, c'est-à-dire donner du sens au projet et souligner l'importance de leur implication dans ce projet. Ne pas hésiter à dire clairement que ce projet européen est une expérimentation. Comme tout projet, il y aura des aléas à gérer, des ajustements à faire et une direction à tenir. Ils font partie intégrante du projet. Ensuite, il faut s'assurer en amont de la motivation et des capacités cognitives des candidats, ce qu'ont très bien fait nos partenaires sur ce projet. Attention aux problèmes de mobilité des jeunes sans emploi. Il faut également être vigilant sur le fait que c'est un parcours préparatoire qui ne remplace pas les parcours qualifiants, mais qui redémarre l'aptitude d'apprentissage. Un autre des points importants est qu'une fois le processus cognitif redémarré avec des outils innovants, il est possible et même souhaitable de repasser à des modes d'apprentissage traditionnels. C'est la grande leçon du projet BHC 21. Les outils mis en place servent de produits d'appel pour attirer les jeunes vers l'apprentissage et une fois que nous avons donné du sens à la formation, nous pouvons nous passer de ces outils.
Over een aantal zaken heb je natuurlijk weinig tot geen impact, zoals de COVID-19-crisis of projectmedewerkers die een nieuwe uitdaging aangaan. Achteraf bekeken zou het goed zijn om op voorhand meer tijd te besteden aan het doorpraten van een aantal verwachtingen, uitklaren van een aantal algemene begrippen enzovoorts om geen misverstanden te hebben achteraf. Het Orpheus-project liep immers tegen een aantal uitdagingen aan, waaronder het navigeren door verschillende talen, de definiëring van concepten zoals bijvoorbeeld preventie, maar ook de verschillende werkprincipes of lokale beleidsculturen. Het waren allemaal zaken die uitgeklaard moesten worden. Wat voor de een evidenties zijn, zijn dat niet voor de ander. Zulke setting dwingt iedereen ook aan introspectie te doen en van daaruit zo helder mogelijk te communiceren. Er moet zeker voldoende tijd voor uitgetrokken worden om het niet alleen te hebben over wat we gaan doen, maar vooral ook hoe en waarom we het op een bepaalde manier gaan aanpakken.
The advice that I would give to other project applicants is to be aware of the differences in healthcare systems and intercultural difference, and think in advance about how these differences can affect your project. For example, we experienced that in UK, Twitter was a good medium for the multimedia campaign, but not for Belgium, where we used Facebook and Instagram. In France, it was important to involve political actors. In the Netherlands, the multicultural context of the Rotterdam area has to be taken into account, where we organized a face-to-face exhibition. We had the same goal with the multimedia campaign, namely increasing awareness and breaking the taboo about perinatal mental health. But the way to achieve this goal was different among the 4 involved countries. A second advice is to work with different kinds of organizations, experts and observer partners. The diversity and different backgrounds is an added value for your project and was also a strength in our PATH project.
Thank you all. Very important and useful tips to keep in mind. What I see is that all project partners agree to say that the more time you spend in the preparation, the more efficient the project will be. Now it is time to close our voyage. As explained at the very beginning of this voyage, we would love to hear from you. What did you think of these journeys? Would you like to know more about a specific story? Maybe you would like to connect with one of the projects presented today. I once again invite you to fill out the survey and send it back to the Joint Secretariat. We look forward to receiving your reactions and we will make sure to provide you with answers, of course, to your questions in due time. Goodbye, au revoir, tot ziens, and maybe see you again for a new trip in 2024.